Hi, good evening. Steve Adler, uh, Austin City Mayor. Got a minute? Let's go over some of the numbers here tonight in the two dashboards. Just a couple things to touch base on. Hopefully, if I can make the technology work, this won't be a particularly long event this evening. Let's begin by taking a look at the dashboards. The first one we look at is the key indicators for staging. This is the one we traditionally and always look at. Let's look first here at new admissions. 77 is the number. That's below our 7-day moving average of 86. You can see on the chart that maps these out, the number came down just a little bit as we were headed downward a little bit. This is an encouraging number in that admissions are going down. At the same time, new cases continue to rise. Yesterday, we had a number over 700. Today, it's 745, and the 7-day moving average is 622. Usually, an increasing new case number results in a few days to a week after of new admissions. So we're going to have to continue to watch these numbers because this is a discouraging sign. This is a more encouraging sign that we're looking at. Positivity now is calculated at 16.2%. It's shown here. We talked about that yesterday on the charts that we saw. This past week, the prior week, the week that ended January 2nd, positivity was at 17.8%. The week that ended the 9th, it's down to 16.2%. But yet we had an increase of the number of new cases. The percentage of positivity went down because the number of total tests went up. So that is an ambiguous indication for us. But one that obviously will continue to watch. So let's look at the next number. Let me stop the sharing here. We'll share now the screen with the next number. Let me see if I can do this. We want to share now the second dashboard. You can see the number on the second dashboard. Number of people hospitalized is 607. The 7-day moving average is 583. So the number of hospitalizations is something that is going up. ICUs, 185. The 7-day moving average here, ICUs 185. The 7-day moving average is 177. So ICUs going up. That's down 5 from yesterday. We had up to 190 in our ICUs. I'm going to talk about that in a second because we all know that 200 is the planning number we had for the greatest amount of ICUs that we could actually staff. Ventilators, the number is 104. The 7-day moving average is 107. We have tonight, as you can see, 582 deaths. This is up 4 from yesterday. In this surge that we have been seeing, we've seen accelerated mortality. We're really stretching the fatality program we have in the city. We're going to start running into challenges with respect to the number of people we'll have that have passed away. Number of total cases up to 58,000. Those are the numbers. If we take a look at the University of Texas dashboard, we can see what the modeler is projecting. University of Texas dashboard, Dr. Myers tells us that the virus is continuing. We have an R factor above 1, lower than the 1.3 we were seeing about a week ago, 1.12, and it seems sometimes to almost bounce back and forth between those numbers. But you can see hospital admissions as predicted with the aqua line here is not as vertical as the line is when we're at a 1.3 R factor. The 1.12 R factor still has us going up and going up too much, but not going up as vertically. This is hospitalizations. This is ICUs. You can see how close we are to the 200 planning number for staff ability to staff beds. This number at 1.3 at a 1.3 R factor was pretty much vertical. It's now looking a little bit more of a diagonal, and that's a good sign. But we're going to have to pay attention to these numbers over time. If we have a change in behavior, it's something that I hope we begin to see by the end of this week. Let's talk for a second about ICUs. We're yesterday about 10 away from the 200 mark, today about 15 away. That was the number of beds that our hospitals said that they would be able to staff under existing conditions. We said we had physical space where they could surge and put more ICU beds in, but they didn't have the staffing to be able to do that. As we've gone through the virus, the hospitals report that they have gotten some staffing from the state, which is good. The state regional and our region O, TSA O, which is Austin is in, reports for Austin area 380 requests have been placed in for state staffing. 270 have been deployed. We're still trying to get additional staffing for that additional 110. Have not gotten that yet, and the staffing from the state is beginning to slow down as the demands statewide are increasing. But what that means is that our hospitals in the area have gotten some staffing assistance with ICUs, so they're going to be able to surge above that number. We also know that the hospitals are adopting contingency plans with respect to staffing so that they can spread their staff out among additional ICU beds. If there's a team of 4 people that would ordinarily be helping someone, now we have 3 plus a new team member that might not have the same training or skill or seniority as the regular person. But by doing that, we create more teams of 4. That's the kinds of strategies that our hospital ICUs are taking a look at. They have told me on the phone call we have today, because I'm regularly on the phone call with the CEOs of the hospitals, not to let up my efforts at all in talking to you in the public about the need to mask and social distance. While the hospitals are trying to cope with a number that's up this high, they are stressed right now, as you would expect they would be when we got to that 200 number. They still want me to keep reminding you, requesting the changes in the behavior, to express the urgency, and to continue lobbying our state leadership to get as much assistance as we could possibly get. Let me talk about vaccination. As you know, up until a few days ago, Austin Public Health had only gotten 1,300 vaccination to give to people. We lobbied the state to try and get more to Austin Public Health. We said we could give out a lot more than that. We can give it on the east side where the hardest hit people live, and we could do it through community care and Peoples and Lone Star, so we could get it to people that predominantly don't have insurance or underinsured, people of color, essential workers, the people that if they get hit with this virus are most in danger, most vulnerable, most at risk of having a really serious go of it. The state responded by giving us 12,000 vaccinations. We gave out 600 in an event led by Judge Brown and Constable Morales this weekend. We're able to work out some of the bugs. On Monday and Tuesday, we opened up a vaccination center. Most of the people that were able to get appointments during those 2 days are the clients of Community Care and Lone Star and people who are underinsured or most in need, don't have insurance or are underinsured folks. The folks that have the highest positivity rates, trying to get vaccines in the east part of town where we have the highest levels of positivity by zip code. It went really well. The goal the first day was Monday, working things out, was to get 900 vaccines delivered. They delivered 850. The second day, the goal was to get out 1,100 vaccinations. They got out 1,650. I haven't gotten the numbers yet from today's vaccinations. I do know that some of the people that got vaccinations, not most of them, and I know that because I was out at the vaccination place on Monday and could tell, seeing the people that were going through, that the overwhelming number of people that were getting vaccinated were people that were older in our community and of color, and a lot of people that have real physical impairments, but there still were some people that were able to get the vaccine that didn't fall into that group. It's hard when somebody comes there that is qualifying and their caretaker is with them, to say no to the caretaker, to say no to the person that drove them. If someone comes and waits in line for a long time, it's hard to say no. So there were some people not in that qualifying group that got the vaccine on Monday. It became apparent, though, that a lot of people heard about that and then started showing up at what was an otherwise undisclosed location, wanting to get the vaccine, understandably, having heard that other people were getting the vaccine the day before that were not in the more vulnerable group. Austin Public Health, as you might expect now, started a very strict policy that you don't get vaccinated unless you have gone on to register and have a scheduled appointment. I know that means there are a lot of disappointed people that show up that aren't able to get the vaccine. But frankly, that's a supply issue. We have 250,000 people that qualify as really vulnerable in our city. And right now we have, 12,000 vaccinations that we're able to give out. So most of the people that are vulnerable and deserve and need a vaccination now are not going to get it this week. Hopefully, we can get an increasing number of vaccinations over time from the state, and we can start giving it to more and more people. No system is going to be perfect, but from everything that I'm seeing, the goals and the principles are generally being applied, and it is it feels really good to actually be there in person and see the overwhelming number of people that are getting this vaccine, or the people that are most vulnerable that you would want to have this vaccine. Today, they opened up Austin Public Health, the portal, so that people could go online and try to get an appointment. Just like the testing system, when you go onto that site, it asks you a series of questions about your demographics, about your health history, so that it can determine who it is that is most in need. What your priority is, because they're giving the spots as they become available to the folks that are most in need. Remember, there's not going to be any questions about citizenship or documentation status or anything like that. And this is protected information under federal law because it's health information. But by 10:30 this morning, 4,000 people had gone on and had gotten appointments here over the next 3 days. Over 20,000 people had registered. And the system, brand new that we rolled out this week, got overloaded, as it has in many, if not most cities all over the country, with a number of people that are trying so desperately to get a vaccine. No one's information was lost. 4,000 people were able to be scheduled for the remaining, I think, 8,000 total tests. Other people were able to register. Austin Public Health is now able to go back to those people that registered, that didn't get a scheduled appointment, and get as many of them as we can possibly get an appointment. So you should go online, register, answer all those questions. You're not going to get a scheduled appointment right now. And as a scheduled appointment becomes available for you based on your vulnerability, Austin Public Health will email you or text you or call you, depending on which you want. Remember, too, you don't have to have a computer to be able to do this. If you can't do it online, call 311, and the operators will take you through the system. For those folks that don't have a computer, or people that are visually impaired, or otherwise that need that assistance. Know that we have thousands and thousands of people, vulnerable people, that are seeking vaccinations right now, and we don't have the supply this week. But also understand that we're going to be getting this vaccination out as quickly as we can. And I think that for the most vulnerable in our community, it's just going to be a matter of weeks until we're able to do that. But we're going to need people to be patient with us. If you have insurance, or you belong to a different clinic, have a different provider, if where you're employed is participating in giving out vaccines, best you do that than to and leave the places through Austin Public Health for those that need to be getting it through Austin Public Health. So if you have private insurance, if you have a primary care provider, try that, try the pharmacy. Know that in the city dashboard, when you sign up at this point, you're only signing up for Austin Public Health available vaccines. There's not a centralized place to go to, one place where you can sign up on anybody's scheduling list wherever they are. That's a difficult thing to do, because a lot of these providers, the pharmacies, the grocery stores, they have their own systems, and it's near impossible to get all the various systems integrated into a single system. But we have a sales force. We're inviting other people, other providers to join us on this platform. And I hope over time we're going to be able to get more and more of the people, of the providers participating together on that dashboard. In Texas right now, you can sign up on any dashboard anywhere in the state, because those are the state's the state's rules. If you go on to the City of Austin website, you can pull down the press release that went out this morning about the vaccination effort that the city is launched, and the website that right now you can't schedule an appointment, but you can register and then be told when it's able to start scheduling again. The City of Austin will give out the remainder of its 12,000 tests here. Got another chunk today, but also Thursday, Friday, Saturday. We have capacity to do even more, and hopefully the state will give us even more. If you live in the Pflugerville area and you want to get tested in that site, please go to Curative, CURATIVE.com. That used to be just a walk-in site for testing. It's now appointment only. Please know again that if you want to, if you're visually impaired or otherwise can't work on the computer, please call 311 for assistance. That's all the virus news that we have here today. Tomorrow is Thursday. We usually don't do this Got a Minute on Thursday. We'll be back on Friday. I'll tell you personally, I was pleased to see the impeachment go forward today. Just scary to see the actions this past week, to have congressional staff members that are hiding underneath desks in dark rooms with folks banging at their doors. Had to be a really scary thing, and it's a scary thought to think about with Americans and citizens hiding under desks while other American citizens are outside pounding on the door. We have got to move to a better place in our community. We have to get through these next week and period of time. I see the same kind of social media rumors that you probably all do about protests and activity beginning this weekend through the inauguration. Our Austin Police Department and Chief Manley assure me that they are aware of the situation, coordinating with the state and being real prepared. I would suggest that beginning Sunday, that you just avoid being in the downtown capital area, just as a precaution. There may be demonstrations. I would urge you all not to consider counter demonstrations. Let's focus on the upcoming legislative session. Let's focus on the things that are on our agenda, and let this other chapter in our lives move on. That's all I have. I will see you on Friday. Take care. Good night, and be safe.